So here in a couple hours, it looks like we're going to have the Affordable Care Act go into effect. The exchanges for healthcare will open up, and we'll see what the hubbub's all about, right? I want to clear up just a couple things real quick, because I was at work today, and there's a lot of excitement going on. You know, people are saying, hey, everyone is going to have healthcare. Well, ladies and gentlemen, if you don't have healthcare now, you're not going to have healthcare in the morning, okay? All the Affordable Care Act does is say, hey, you got to get off your couch, get on the internet, and shop you some healthcare insurance. That's really why the insurance companies and groups like AARP supported this, is because we have 330 million Americans who, as of tonight at midnight, need to have health care insurance or have a year to buy it. And so the clients for these insurance companies are going to increase dramatically, which also increases their income, of course. I mean, there's a lot of profit to be made by these insurance companies, and that's exactly why they're supporting it. And there's an argument to be made that down the road, this will devolve into a single payer system, which will be the government and put everybody else out of business. But ladies and gentlemen, there's profit to be made in fiscal year 2014, and there's shareholders to pay in the year 2014. So regardless of what happens in 2020 or on down the road, there's profits to be made right now. And in the capitalist system we live in, that I support, you know, that's what we're going to do. We're going to make the money now while we can, regardless of the consequences. Damn the torpedoes. There's profit to be had. And so that's why the insurance companies are supporting this. And you have to go get yourself some health care now. Now, why are healthcare policies increasing? Like, I've had my healthcare insurance, you know, my entire life. You know, I haven't had a year of my life without healthcare. How about that? Isn't that lucky of me? Well, you know, what's changed in my life to cause my healthcare to increase dramatically like it has over the past 2 years, actually? Well, it's because we're bringing in all these new clients. And what I think is happening, this is interesting to me because there's like a social aspect to this as well. And that's really what I want to talk about real quick, is I think we're building healthcare social classes or healthcare classes. For instance, and follow me here, there's going to be people that don't work and don't have jobs. They're the people that right now collect food stamps, welfare, Social Security, disability because they are disabled. Well, those people don't earn enough money to qualify for the more expensive health care plans. That's not a change. They couldn't do it last year. They're not going to be able to do it in 2014. But they will qualify for a voucher, okay? So that's the voucher class. The class above that, in my opinion, is what I call the Walmart class. If you go to any Walmart in America, you'll see what I'm talking about. And these are the people that make just enough money to live comfortably in their little home or a really nice trailer and buy everything that they need at Walmart prices. Okay? And I would submit that this is probably the least healthy class in America. Go to any Walmart, you'll see what I mean. Okay, and there's classes above the Walmart class, and I'm not going to go over all of them, but they get increasingly higher in income and can afford the nicer plans, the platinum plans, the Cadillac plans. They all have these nicknames. Okay, so as an insurance company, who are you going to insure? Who are you going to take money from and cover the health care cost of? Someone who is on the food stamp welfare plan? Someone who eats everything they sell at Walmart? Or someone who can afford a Cadillac plan and has a higher income? Which one of those, just call them three general, very vague classes, do you think is the more healthy? Well, I would submit the higher income one, in my opinion. Okay, you already know the ones on Social Security, disability, and receiving things like, you know, Medicare, Medicaid, the older people, are already injured or, you know, near death. They're getting upwards in age. Let's be kind about it. And so they're not healthy to begin with. They may not be the least healthy, but they're not exactly the epitome of health. You have the Walmart class who, you know, you can almost call them the junk food class. You know they're not living healthy lives as a group. You know, I'm sure there's exceptions in there. So the insurance companies are going to have a lot of Cadillac people to pay for the healthcare expenses of the lower class. And I submit to you now, we'll see if I'm right in the morning, that there will be a few companies out there that only offer the higher end Cadillac Platinum policies. Okay? The other side of this is, if a person can afford your policy that you set the price of, you have to accept them as a client, regardless of their previous condition. If they have cancer, if they have Parkinson's, any kind of disease, if they can afford to pay your premium, well, guess what, insurance company? You're going to have to accept them. That is the second reason why the policy rates are going up. Not to just make more money, which it's doing a great job of already, it's to protect the company from liability. If a person that's only earning Social Security disability because he has a disabling disease and can't work, he's not going to be able to afford the higher platinum plan. Well, you can protect yourself as a company by not offering coverage for people who can't afford to pay thousands of dollars a month for their health care. That's another part of it, and I'm convinced that's why my insurance rate went up. To gain profit from me, which is part of the deal. Guess what? We live in a capitalistic society, but it's also to protect the company from the people who are going to drain it. The companies that take advantage of the vouchers, I believe, will be fly-by-night companies. If they want to focus on the lower end, good for them, but good luck staying in business when you're paying out month after month to support clients that put in less than their medical bills cost. You can't run a business like that. And that goes to the argument of a single payer system. So we'll see what happens in the end. And real quick, I want to go back to the government shutdown thing, is that this is not about, the government shutdown is not about healthcare. It's not about the Republicans or the Democrats or even the political system. As the healthcare debate is only 1/6 of our economy. Therefore, there are 5 other parts that go along with it that nobody's talking about. But the biggest overall part of that is the budget. We haven't had a budget approved since 2008. So that's 5 years. 2014 is going to be 6 years with no budget here in America. How in the world do you run a country or a business, your family, anything without a budget if you don't know how much you can spend? Because they don't have set limits on how much they can spend, defined by a budget, they've been spending like crazy, especially in the last 6 years. Even under the Republican administration, hell, especially under the Republican administration, they spent crazy the last 4 years that George W. Bush was in office. Okay, so this isn't just a Democratic problem. I don't want to hear that from you conservatives. And it's not just a Republican problem either. So I don't want to hear that from you Democrats either. Okay, this is a political systemic problem that we have. The issue here is the budget's not been passed, and it hasn't been passed on time since 1994. I bet you didn't know that. It has, what's called an omnibus, has passed since 1994 to 2008. Where they always did have a budget eventually passed before January 1st, the calendar year. Okay, and that's called an omnibus. And what the politicians have learned to do between 1994 and 2008, and sorry for getting in the weeds here for you, is they take all the things they can't get approved during the regular year, and they wait till after the fiscal crisis begins of October 1st, and oh no, do we have a government shutdown? Will we get a budget approved? And so they have to get something approved before January 1st, and they throw all their pet projects into the omnibus. Check it out. Learn for yourself. And then the omnibus gets approved, and that's how our debt is increased greatly, and all these pet projects get done. And it's become a systemic problem. Well, in 2008, they just stopped the charade altogether. They said, you know what, we're not even going to bother with the whole song and dance. We're just going to do what's called a continuing resolution. And they've done that now for so long that it's had its own acronym. They call it the CR now. We're just going to do another CR. And they come on TV and they talk about the CR as if everyone knows what that is. And I submit that you do not. And that's just where you continue the budget as established, and that's really what this is about. It's about fiscal responsibility. Anyway, thanks for watching. Revolution starts in October. See me. 5.56.